We do not expect intimidation because an IA is not a matter of fun. We do not enjoy this. We do not enjoy the suffering of patients. An IA is on the background of frustration, of hunger, of poverty. We are having meals once a day. It's like taking ceftriaxone. And we are expected to work sometimes 36-hour shifts. I'm expected to be on duty.
Currently, we have an interns mess, and this is occupying about 16 out of the 52 interns that were allocated to come to hospital. This leaves about 75% of these interns to go out wander looking for accommodation for themselves. Most of these that get fortunate get accommodation in places they don't know about, and the average rent of an intern goes to about 300,000, not leaving out the cost of the food that goes to maybe 10,000 for a plate, that is for lunch, 10,000 for plate for supper, this leaving us at 20,000 as a cost of feeding for an intern in Arua Regional Referral Hospital. Not to note about the insecurities that have happened to most of the interns that have come to Arua Regional Referral Hospitals. We have colleagues, we have so far lost a total of about 6 laptops, phones have been lost, a lot of property has been lost to intern doctors who sleep outside the hospitals because of insecurities. This has gone neglected. No one comes to the rescue of interns because we are expected to survive on our own. It is on this background that FUMI, which is our mother body as interns, the body that covers interns in Uganda, we came out as intern doctors and started our industrial action, which started on 1st of February.
An intern could mean the space between life and death for a patient. So it is important that such a person is kept akimbo and on duty. We have our tools ready. We are ready to report to work. Immediately our issues are addressed.
If you try to observe the number of rooms which are here, you are going to realize they are less than 20. But to inform all of you, we are around 60 interns in this site. So that means that most of us are renting outside the hospital, and we are forced to do night shifts, of which all of those will require us to come and go back. So I'm now inquiring from any of you, if you are the one, how can you maintain the highest level of practicability when we are moving from 10 p.m. to the hospital to work, and you want to move a distance of 20 kilometers? So, and most of you all know the situation around. It is not that most of us always have that available money always. Because if you are trying to inquire from the behind, you see that government pays allowances every after 3 months, of which those three months, most of them don't even come on time. So our sincere request is that if government can raise our money at least to a half of the medical workers, even if they be paying like by tri-monthly basis, at least it can cater for those months which can be left between reaching to the next pay.
To less than 20 people. People are actually forced to share a room, which is very small. You cannot make an adult to share a room. But because of the safety and the well-being of ourselves, we decided to share the rooms. But then there are friends who are still left and they have to rent outside. We're being paid 1 million. On top of that 1 million, you have to cater for accommodation, you have to cater for your meals, you have to cater for transport.
For example, in Arua, it is a hepatitis B endemic area. In the 10 patients that we are receiving, 6 or 7 of these have hepatitis B. An intern who gets infected in the line of duty has nothing covered. There is no insurance that is covered for this person, and for those who go ahead to suffer permanent damage in their lives, nothing comes out from the government to help these people. So we continue to cry out to the media people. We cry out to all the support systems of this country, the Minister of Health, the President, whoever he is, to at least come out and rescue the interns in this situation that we are having. The Ministry of Health has been silent ever since we declared our industrial action, which means that they do not care about the interests of the interns, and this is something that has showed how these people at least do not care about the people who are providing the crucial workforce in the Ministry of Health. Yes, so there are a number of issues, but we will be ready to return to work once the ministry and the president at least come out and our issues and our points are heard. These are the matters that we want at least a response from the ministry. because it is noted that in 2021, the president came out and issued a directive that after having sat with UMA and all the other professional bodies in Uganda, he found it fit for an intern doctor to earn half what our seniors earn. Last year, at the start of last year, the Ministry of Health came out and they defied this directive, coerced us, and we were forced into this internship at a pay of 1 million Ugandan shillings. The ministry did not come out with a clear criteria that they used to arrive at and give us 1 million. This comes in defiance of the presidential directive